All right, welcome everyone. Thanks for this opportunity to share the GE Healthy Imagination story in Saudi. We've learned a lot from all of you today, and so we really hope that we can impart something to you. My name is Mel. I'm head of content at TBWA, and I'm here with Hani, who's heads up the Imagination Breakthrough at GE. Big blue. So first, Hani's going to give us a quick overview of health imagination and healthcare.
Good afternoon, everyone. It's usually tough to have a crowd in the afternoon, so I unfortunately have no jokes or anything, but my first time to Beirut, beautiful city, I have to say. Getting off last night, I thought it was in San Francisco with the lights up in the hills. Very nice. Like Melanie said, I'm with GE Healthcare. This initiative itself is a corporate initiative. So just to let you know, Healthy Imagination is something that GE Corporate is doing globally. I'm with the GE Healthcare division and currently based out of Riyadh, focused on what we call the Eastern and African growth markets. Okay, so that's for us, the Middle East, Central Asia, and all of Africa. So with that said, this Healthy Imagination story specifically is going to talk about how we sort of localize this for Saudi and how it's impacted or helped Saudi women with this initiative. So just kind of at the macro level, you know, healthcare, we all know, is sort of at a crossroads. There's a growing population continuing to struggle for limited resources. There is an increase in disease burdens at a rapid rate, and you know, we've got shortage in healthcare workforce, we've got poor infrastructure. So we say healthcare is at a tipping point. There's a need to start looking at new models to approach this, right? So the way we look at it, at the end of the day, what patients want, they want quality healthcare, coverage, and access. Now, on the flip side, governments want to reduce costs, but at the same time serve more patients, more people. So for GE, 2 years ago, we launched the Healthy Imagination Initiative, and this was a $6 billion game changer for us. The idea behind this is that we want to help globally by improving quality of healthcare, increasing access, and reducing cost. And our internal goal is to do this by 15% by 2015. And you guys may ask, you know, how are you going to measure this, and you know, what's the impact? We're working with an outfit out of UK called Oxford Analytica. And so what we're doing is, whenever we're launching products under the Healthy Imagination banner, we're measuring the impact. These guys, independent to GE, help us understand, is it really helping reduce the cost of delivering healthcare? Is it really increasing access? Is it really improving quality? So they put some hard measurements around this. So to that point, between 2009, 2010, we've launched about 43 products that have been validated by Oxford Analytica. Okay, so these products have touched over about 200 million or so lives. And we're working on continually developing products that are specifically designed and positioned for emerging markets, for specific regions. I mean, a couple of products I'll highlight is the Mac Eye. It's a cardiology device in India, for example, that we've launched. It's a $500 device, but each scan is the cost of a bottle of water in India. So again, it's providing access and at the same time quality there. We've also launched our V-Scan, which is a handheld ultrasound imaging device. Literally, it sits in the palm of your hand with a probe. We've deployed this in Indonesia, we've deployed this in Africa, again, addressing the rural needs of emerging markets. So specifically to Saudi, you know, Saudi is an interesting market because when you look at the sort of the health index, Saudi definitely ranks up there when it comes to lifestyle diseases. You're talking about obesity, you're talking about diabetes, exactly. And there's some really startling statistics around Saudi. So for us, what GE has done, back in 2010, the Ministry of Health embarked on really focusing on transforming healthcare. You know, they really want to look at not just infrastructure, but they really want to look at best practices. They really want to take their care pathways to the next level. So we basically signed a partnership with the Ministry of Health under the Healthy Imagination banner, and Melanie will talk to you about some of the initiatives that we're working with them on. And essentially, it's to address disease burden. It's to address e-health, for example, primary care. Saudi has a younger population as opposed to other countries. Japan, you know, is more of an aging population. So there are different sorts of awareness type of nuances that you have to address there in terms of who you're trying to deal with in terms of the masses. So, you know, with that said, I'm going to hand it off to Melanie. She's going to talk to you a little bit about best practices, but if you have any questions, you know, feel free to make it an interactive session like the last one.
So, now I work in advertising, but as you can tell, with all of these challenges, you know, a standard advertising campaign-based solution isn't going to cut it, right? Our challenge, you know, we had high obesity, underdeveloped culture of health and fitness, and lifestyle limitations. So what we needed to do, what we really needed to do was start changing behavior and attitudes. However, before we could begin to develop and share information, we had to define our target audience. Who are we talking to? So that's kind of the first thing that we did. And what we needed to do is we needed to understand how they interact with content. Where are they looking for information? What kind of information are they looking for? And how do they interact with that content? So our first step was research through social channels. You might have heard the talk about social listening. We did that in Saudi, and we found out some really interesting things. Let me take you through them. The first thing that we learned was that women are actually the key decision makers for families when it comes to health. A little bit surprising, perhaps, but you know, when we did the social listening exercise, that's the first thing that we learned. They make the choices on food, medication, fitness, and so on. However, as much as they're driving these decisions, and as much as they use the internet to inform themselves, we found a gap, basically, in terms of relevant information in their language, Arabic. Now, of course, when there's a gap, there's an opportunity, so we sought out to fill it. The big question is, how do you fill a gap? You know, easier said than done, right? So we felt GE had a significant opportunity to create a behavioral shift through education, social awareness, and engagement. We started with women because of the gatekeepers of family health, and the real reason why we did this is because they could impact their families, they could impact the country and generations to come. So it was an interesting kind of insight when we chose our target audience. Now, everybody here, I'm sure, knows the importance of social media and its transformative power. You know, we've been talking about it all day. It's obviously a very transformative medium. However, for GE Health Imagination in KSA, it was critical that we use social media to deliver high-quality content and engagement that's relevant to the Saudi audience. So it was really a social approach to a social problem that we took. So how do we do it? You know, once again, easier said than done. We took a three-tiered approach. The approach was education, Saudi-specific content, and tools for family health. Conversation, engaging around key healthcare themes and goals, and creating buzz. You know, we tried to create some firsts for the region, things that we could be proud of, things that would create a lot of PR. So I'll take you through those a bit later. So for education, we focused on healthyimagination.me, which is the website. We also have a really popular Twitter and Facebook page. So those were our three kind of ingredients. And the approach that we took was fairly balanced. On the website, what we really went for was having a lot of articles in Arabic. You know, we have over 100 articles and growing like every week. We have a content plan that we follow every month, new, fresh content that's relevant. And the kind of topics that we follow aren't ones that you can always find it somewhere else. You know, it was really a matter of kind of filling the gap. For instance, in Saudi, you know, how do you stay fit if maybe you don't have access to a gym? How do you keep your family healthy over Eid? How can you eat preventatively with classic Arabic cuisine? These are the kind of articles that we covered. And the last thing that we really focused on was making things intelligent, like not being patronizing. You know, the last thing you really want is a brand patronizing you. You know, no one's going to connect with that kind of content. So it's really a matter of like creating a personal connection and not talking down to people, not patronizing, and being positive. Now, okay, within this framework, it's fair to say that content is king, as they say, or content is queen in this case. Here's our sites. We had as I said, lots of content, lots of locally relevant articles on family health, nutrition, and fitness. We have thousands, yeah, it's quite a few. We have a significant following, and the important thing, honestly, is it's not about numbers of followers. It's about, are these people actually in the community? Are they engaged with the community? You know, a lot of times people, you know, you can buy followers on Facebook. So it's not really the numbers that count. It's the quality of the audience. True. It's all about connecting with our audience. So, okay, so we created an ecosystem, basically, bringing together key healthcare topics every month, keeping the conversation current, and attracting influencers. You know, we've really created connections in Saudi with the Ministry of Health, for instance, and with doctors like Dr. Samia Al-Moudi, who's a really prominent physician in Saudi on breast cancer, yeah. And, you know, we've tried to forge a space for an active, open dialogue on our Facebook page. Now, the thing that we're most proud about with our page is the fact that, you know, we get a lot of engagement. It's people actually creating conversations in Arabic. They're asking questions. We're, like, engaging with them. And it's not just about having 1,000,001 likes on every post. It's about actually creating conversations. And another thing that we tried to do is we had some activations. So things like healthcare challenges, visualization tools. These are kind of more, you know, designy kind of things that we did to create engagement with the community. Visualizing health is one thing that we did, and sharing events. These kind of more activational sort of things really helped to create engagement and also create that dialogue with people. And we were talking about a lot of healthcare tools earlier, and we did one small one that we're quite proud of. It's called Morsel. In Arabic, I can't pronounce it. Sorry, I'm terrible at my Arabic pronunciation is terrible. But what it does is it provides insights into family health, and it gives you healthcare tips every day, things that are relevant to Saudis, it's not just an app that we forced into this culture that doesn't relate at all. We've tailored the content to the market, and that, I think, is something to be proud of. So you can see a trend. It's about letting people choose the channel that they want and delivering content to them. You know, we don't believe that, you know, my mom might not be interested in a Facebook app or a mobile phone or whatever. You know, so we're trying to deliver content that's relevant to her. One of the more interesting things that we did that's quite interesting is we created an EComic. So we didn't just create content and tools for Saudi women, we made some tools for them to educate their families. And we tried to do it in a fun way. This is a series called Adventures of the Al-Karat Family. And we used iPad because it's a great tool for engaging with young people and because it just felt right. It's one of these kind of direct tools for the family, you know. It's a storybook for kids, and it also has recipes for moms. It's really fun, and it's something that doesn't compete with fast food advertising. It is in Arabic. It is. It's in Arabic and English. I just put the English one up here, but it's available both in Arabic and English. In fact, yes. All of this content is in Arabic. In fact, we have much more content in Arabic than we do in English. Yes. All of our, I would say about 95% of our communication is in Arabic. Yeah. Okay, so let me take you through a video of this EComic just because it's kind of fun. This is the EComic. And so we don't want to compete against fast food advertising, which is obviously as prevalent in Saudi as it is anywhere else. So we created this EComic for young kids with these fun characters. So we're reflecting Saudi family values.
Attack of the Veg Mondays is the first adventure in the series.
Can you guys hear that?
More vegetables into the family diet. Not an easy feat when one family member will do whatever it takes to avoid them. Targeted towards those with the most pestle power in the household, the story proves to kids that healthy food doesn't need to be boring. With an intuitive navigation that lets you slide from scene to scene with ease, kids can explore the story without parental guidance. And with tools for moms to share recipes and read articles on health and fitness, the app becomes a real learning resource for the entire family. And just 1 week after the app launch, and with no paid media, thousands downloaded Al Khairat Adventures. National media spread awareness even further. Women across the kingdom wrote into our Facebook page to say shukran. And we changed the playing field for health with a branded edutainment platform designed for change that Saudi families can be at home with.
Okay, so that's Adventures of the Al-Karat Family. Now, breast cancer is, as Hani was mentioning, a really big challenge in Saudi. How many people here have been either screened for breast cancer or know someone who has been screened for breast cancer? Okay, so quite a few of us, right? Well, that's great, but it's not really the case in Saudi, as I'm sure many doctors here will testify to. Unlike campaigns in the rest of the world, it's going to take a lot more than a Twibbon campaign to close the gap. So we came up with a campaign to tackle culturally taboo healthcare subjects, such as breast cancer. Now, I'd just like to take you through this next video and show you how we address the issue in our socially led campaign entitled Avatar for Action. And we're particularly proud of this one, too, because we won a couple bronzes at the Lynx this year, which was something to be proud of. Yep. This was in partnership with the Department of Health in Saudi. That was the main partnership. Yeah. So, I think we were talking about this earlier, but, connecting with governments sometimes can really facilitate things. So.
Many women in Saudi Arabia believe that breast cancer is a black and white disease. Either you have it and you're helpless, or you don't and you're blessed. Women are burdened by misinformation, fear, and taboo. That's just one reason why they take a passive stance on their own health. So as part of GE's commitment to creating better health for more people, our challenge was clear: to get women in Saudi to overcome these barriers and raise awareness and inspire people to sign up and support the nation's first mobile breast screening drive. We knew the solution wasn't just another Facebook app, So instead, we tapped into the one online behavior that's been popular in Saudi for ages: the creation of aliases and avatars. We took the design your own avatar habit and threw the convention on its head for a good cause. GE's Avatar for Action gave Saudi women a chance to create something different: a call to action, a wish, a word of thanks, and more. It's a simple and non-threatening way to empower people to create change in their community by designing an avatar, choosing a message, and sharing it with their community as discreetly as they wish. Next, we brought people together with a symbol of hope. We launched the Avatar for Action Parade, the first ever countrywide parade of its kind, both online on popular sites and in real time at the Screening Drive launch event. There, we took the same pure support and encouragement to the ground. Attendees could view the parade and even design their own avatar on touchscreen displays. In seconds, they could see themselves dynamically appear on the screen before them. As more people shared their avatar, the community grew exponentially. Slowly, the silence that once concealed breast cancer from social media began to fade, and in its place, a new dialogue emerged. The GE Facebook page soon became a daily hub of support, discussions, and information. In just over a month, thousands of avatars were created and shared. Our Facebook likes and engagement grew dramatically, and we answered more questions on breast cancer than we ever imagined. Popular local women's programming spread awareness even further, and a vibrant, active, and supportive community of people came together that symbolized hope, action, and change.
Okay, and once again, that was all in Arabic as well as English. Most of the communication was in Arabic. So those are some of the things that we've taken part of with GE. Here are our results. Now, as I said earlier, numbers are important, but they're not the whole thing. In our minds, it's the connections, the conversations, the education, and the advocacy that tell the real story, much more than the likes, shares, and followers. So what's most important to us, in just over a year, where once there was next to nothing, today over 15,000 women in Saudi ask, learn, discuss, and exchange in conversations around improving family health. Now, what can we take from this? I've nailed it down to 4 different points. 1, consumer insight. Find out what people really want. 2, find innovative online channels for people to use. Do something different. Create a few firsts. 3, as always, quality content. Don't forget it. It's not just about having an app. The app has to be about something. It has to say something. It has to have a perspective. And 4, an artful delivery always helps as well. And that's it. I'd like to thank you. Thank you very much, Hani. Any questions? That's a good question. Well, do you want to answer?
Yeah, so Healthy Imagination as a website was something that we launched in the US, obviously, or in English corporate. And it was Arabic was the first language we localized it into. We are looking at other countries, so you will be seeing that very soon. We are very soon. There are many countries in our region that would prefer to have it localized in their language. So yes.
Did you hold a TV campaign supported by the MOH of Saudi government, or did you just use the social media and YouTube and the like? You did deploy it or distributed it through the TV of Saudi official channels.
Yes.
Yes. Okay.
Yeah, it was.
TV
Everything ran
channels.
there. Yes.
Yeah, I mean, so again, the point here was it's business to government. So Saudi MOH wanted to set up a breast cancer awareness drive. They're going to launch a program very soon around screening, and they wanted to develop a care pathway, bring in tertiary hospitals, do the whole teleradiology aspect, right? So that mobile mammo truck that you saw is part of that offering. So what we did on behalf of MOH was to do this market insights. How do you create awareness? How do you increase these people coming out of their homes and promoting screening? And so that's why we're helping MOH to create that awareness. For us, at the end of the day, you won't see any product placement there. This is truly just being a true partner to MOH.
I was wondering to ask GE if they're planning to expand, especially in the Levant region, since I think the Levant region was one of the only regions or one of the few countries in the Middle East that actually are more open about breast cancer than other countries. For example, in Lebanon, they had a one-wig stand where everyone just bought pink wigs and was supporting breast cancer awareness. Also in Jordan, they did some sort of similar project to this one where they asked women to go and get checked by other women so they feel more comfortable than being checked by male doctors, for example. And they ran a whole campaign as well from the government. So if the Lebanese government and the Jordanian government are willing to cooperate, I suggest maybe GE could do something special and maybe even more provocative or more direct than the Saudi approach.
In this region, we'd love to do something, in the Levant for sure. It would be a great opportunity.
Are you augmenting your service with health information about PCA or the screening process that is directed to targeted consumers, the ones that you are doing testing on them? Are you educating them?
Yes. So education awareness is part of it. We're not just educating end users or consumers. We held a medical symposium. So that image you saw of the conference, that was from our October medical symposium in Riyadh. We had the Ministry of Health there. We had Sami Al-Moody, some of the champions of this initiative in Saudi. We had GE there to really educate and make medical providers, physicians aware of it too.
No, I'm talking about the people, the women you are testing. Are you educating them in any way?
Yes. Well, it's part of the whole care pathway.
With the internet, with the
Other than raising awareness, did you try to approach things like asking them to measure the diabetes, the blood sugar, and follow up with them or their weight, and how do you make sure that they are presenting real numbers in case you took this other step, to monitor them medically, not just by raising awareness, like the initiative for the weight, to follow up with them for their weight.
How do we follow up with the people? That's a good question.
I mean, in the weight, it's not that sensitive, but in the blood, sugar, it's more sensitive in monitoring if they are sending.
Yeah.
In that context, all we're doing is creating awareness. We're saying, hey, you should think about healthy lifestyle, you should think about being active. Even part of the breast cancer program, we're working where you can with physicians and healthcare providers. These diagnoses, to take it to the tertiary healthcare system, we are not involved in that. So when it comes to that kind of thing,
Because that would be the added
Yeah.
value of new interactive technology.
The thing is, if you look at the contents, I'm diabetic myself, so I know. I can tell you the content on the Health Imagination website is really supports diabetics. It's all about exercise, fitness, good eating. And sure, it's not going to tell you okay, it's not a blood sugar monitoring tool. There's hundreds of those already on the internet. You can download. There's so many apps to monitor your blood sugars. So no, that's not filling a gap for us. We want to fill a gap through delivering quality content in Arabic. That's our main Cool.
Thank you.
Thanks.
We're going to wrap up, but if you feel free to stay around, chat. We're going to break for coffee. We're running about half an hour late, so next session will start at 4:30 instead of 4. But thank you very much. Thank you for the speakers.
Thank you.